Hey everyone, welcome back. I am your host, and today we're putting on our detective hats to dive into a seriously fascinating clinical mystery straight out of a patient simulation file. In this explainer, we're going to unpack a super high-stakes medical situation, focusing heavily on the critical nursing priorities you need to manage a complex condition like this. We're going to completely decipher the data to see what's actually going on beneath the surface. So let's jump right in.
The specific file we're tackling today is Scenario 8. We're looking at a critical endocrine emergency. And when assessing patients, these are exactly the types of cases that demand absolute precision. You need sharp assessment skills, and more importantly, you have to be able to look right past the most obvious numbers blinking at you on the monitor.
Before we meet our patient, let's just quickly set our clinical baseline. Diabetic ketoacidosis, or DKA, is a severe complication of diabetes. It basically happens when the body starts churning out excess blood acids, which we know as ketones, because there just isn't enough insulin to let glucose into the cells for energy. This creates a really life-threatening metabolic state, so managing that resulting metabolic acidosis, that is our absolute top priority. Here's our quick roadmap for today. We'll start by meeting our DKA patient, Chloe. Then we'll look at the BSL red herring, examine her Kussmaul breathing and electrolytes, lay out a rock-solid emergency action plan, and wrap it all up with an ISO bar handover.
All right, Section 1, the DKA patient. Let's meet Chloe.
So, Chloe Bennet is a 24-year-old university student managing her type 1 diabetes with a Medtronic insulin pump. But here's the critical point, the trigger. She recently came down with a bad bout of gastroenteritis. Because she couldn't keep food down and wasn't eating, she actually stopped her insulin pump. This is a classic, really dangerous cascade. No food, so she stops the insulin, right? But her body desperately still needed that baseline insulin just to prevent ketosis.
And man, when she hits the ER, it's a terrifying presentation. Her blood sugar is just sky high at 38.5. Her pH is sitting at a dangerously acidic 7.10, and those ketones are massive, 6.2. Now, the ED team rightly stepped in and started an IV insulin infusion along with a 1-liter saline bolus. But as we're about to see, this initial treatment, it's really just the beginning of the story.
Moving on to Section 2. Let's look at the data and talk about the BSL red herring.
Fast forward a bit to 14 p.m., and things get tricky. Chloe is now getting really difficult to rouse. But look at her blood sugar level. It's dropped nicely to 12.0. The status literally says improving. If you're just glancing at the sugar, you might actually think she's getting better. But look at the next lines. Blood ketones are at 5.5. That is still critically high. Her pH is still severely acidic at 7.15. Her sugar might be normalizing, but her metabolic state is absolutely still in active crisis.
And this quote right out of the simulation file hits the nail on the head. Critical alert. BSL improving, but ketosis persistent. Airway risk. We absolutely cannot be fooled into a false sense of security just because of an improving blood sugar when this dangerous ketosis is sticking around. Chloe's getting lethargic, and you know what that means. She's losing the ability to protect her own airway.
This side-by-side perfectly highlights the ultimate clinical trap. On the left, improving blood sugar of 12.0, but on the right, severe acidosis and critical ketones. In DKA, you absolutely must prioritize treating the ketones and the pH. You can't just fixate on the sugar levels. That is the fundamental rule of managing metabolic acidosis.
Let's jump to Section 3, Kussmaul breathing and electrolytes. We need to look at the hidden physiology here.
Okay, we really need to correct a super common clinical misconception right now. The file notes that Chloe is taking these deep, labored breaths at a rate of 30. That is Kussmaul breathing, and guys, it is not simply anxiety. Her deep, rapid breathing is actually a physiological compensatory mechanism. Her body is quite literally gasping, desperately trying to blow off carbon dioxide to fix that severe metabolic acidosis. Recognizing this as a sign of critical metabolic distress is absolutely crucial.
And then there's this number staring at us, 3.1 millimoles per liter. That's her potassium level, and it is dangerously low. It's a huge red flag that emphasizes the severe electrolyte shift risk happening right alongside her acidosis. We have to watch these electrolytes like a hawk, because shifts here represent a massive risk to Chloe as we push forward with her treatment.
Oh, and here's a totally critical nursing consideration we can't overlook: pump safety. We have to ensure her personal Medtronic insulin pump is physically removed or disconnected. Why? Because you absolutely want to avoid a fatal double dose of insulin once her IV infusion stabilizes.
It's a really simple mechanical step, but if you overlook it because you're hyper-focused on the IV lines, the results could literally be catastrophic.
All right, Section 4, our emergency action plan. Let's get these fluids corrected.
This step-by-step checklist really simulates the urgency of our required response. Step 1. Initiate a MET call, the medical emergency team, because her dropping consciousness makes her a massive airway risk. Step 2. Grab an urgent VBG to check exactly where that acidic pH is currently sitting. Step 3. Assess the insulin line patency. If the ketones aren't clearing, you've got to verify the IV insulin is actually going in. And step 4. We urgently need to start dextrose and potassium fluids.
I really want to pause on that last step, because this brilliantly illustrates the core treatment paradox of DKA. When the blood sugar level drops below 14, you must add dextrose to the IV fluids. If you're wondering why, remember this. We add dextrose so the body has the glucose substrate it needs, which lets us keep the insulin infusion running. The insulin is the only thing that's going to clear out those stubborn, dangerous ketones. If we stop the insulin just because the sugar looks normal, the ketosis just keeps raging. Simply put, we have to feed the insulin with dextrose.
Finally, Section 5, the ISO-bar handover. Let's talk about structured communication.
Using the ISO-bar framework ensures that absolutely nothing gets missed in a high-stakes, high-stress environment. Believe me, structured communication saves just as many lives as medical intervention does. So let's break it down.
We start by detailing the identification, situation, and current observations. I for identification, Chloe Bennet, 24 years old. S for situation, persistent DKA and metabolic acidosis. O for observations. Her GCS is dropping down to 12, her respiratory rate is a labored 28, BSL is 12.0, but crucially, those ketones are sitting at 5.5. Instantly, the incoming team knows exactly how unstable she is.
Then we move on to the background, our critical assessment, and the life-saving recommendations we've initiated. B for background. She's a type 1 diabetic, triggered by gastroenteritis, and currently has a fixed-rate insulin infusion in situ. A for assessment, and this is our clinical judgment right here. Unresolved ketosis, with a potential insulin line failure or just inadequate glucose substrate to clear those ketones. Finally, R for recommendations. We've triggered a MET call, requested an urgent VBG, we're assessing the line, and most importantly, we are starting those dextrose and potassium fluids.
I want to leave you with this final thought for today's explainer. Are you just treating the numbers on the monitor, or are you actually treating the patient's underlying metabolic acidosis? When you're facing a red herring, like an improving blood sugar level, take a step back and ask yourself what the true danger is to your patient. You've always got to look deeper than the most obvious metric, because understanding the complete metabolic picture is what truly saves lives. Thanks for hanging out and learning with me today. Stay focused out there, and I'll catch you in the next explainer.